High cortisol is the silent body shaper, and not in a good way. Cortisol is your body's main stress hormone. It's essential for survival, helping you respond to danger, regulate blood sugar, control inflammation, and manage blood pressure. But when cortisol stays elevated for too long, it can cause significant damage to your body and appearance. I'm Dr. Renee Barron, and in this video, I'll walk you through 12 clear signs that your cortisol may be chronically high. We'll also cover the critical difference between disease-level high cortisol, like Cushing syndrome, and normal physiologic stress responses. Sign number 1, a rounded, puffy face, known as moon face. This happens when excess cortisol causes fat to redistribute and accumulate in the face, neck, and upper trunk. It's a hallmark of Cushing syndrome or long-term steroid use, not something you see from everyday stress alone. Sign number 2, buffalo hump. This is a noticeable fat pad that builds up at the base of the neck and upper back. Like moon face, it's caused by cortisol-driven fat redistribution and usually appears in more severe or prolonged cases. Sign number 3, purple stretch marks, striae. These are wide, purplish-red stretch marks, often on the abdomen, flanks, thighs, or breasts. Cortisol weakens collagen in the skin, so the skin tears more easily under tension, creating thicker, more pigmented marks than typical weight gain stretch marks. Sign number 4, easy bruising. Cortisol thins the skin and weakens blood vessel walls, so even minor bumps or pressure can cause large, dark bruises, especially on the arms, legs, or hands. Sign number 5, central obesity. Excess cortisol promotes fat storage around the midsection and internal organs, visceral fat, while arms and legs often stay thin. This apple-shaped pattern is stubborn and hard to lose without addressing the cortisol issue. Sign number 6, muscle weakness. High cortisol breaks down muscle tissue over time. Protein catabolism. You may notice leg or arm weakness, difficulty climbing stairs, standing from a low chair, or even brushing your hair. Not from pain, but because the muscles themselves are shrinking and losing strength. Sign number 7, insomnia or restless sleep. Cortisol should naturally drop at night to allow rest. When it stays elevated, it can make falling asleep difficult, cause frequent awakenings, or leave you waking up feeling unrefreshed even after a full night's sleep. Sign number 8, hair thinning or increased shedding. Chronic cortisol disrupts the hair growth cycle, pushing more follicles into the resting or shedding phase, leading to diffuse thinning across the scalp. Sign number 9, acne and oily skin. Excess cortisol stimulates androgen production, which increases oil, sebum in the skin, and can trigger adult-onset acne, even in people who haven't had breakouts since their teens. Sign number 10, elevated blood pressure. Cortisol causes sodium retention and constricts blood vessels, raising blood pressure over time. Sign number 11, recurrent infections or slow wound healing. Cortisol suppresses the immune system and delays tissue repair, so you may get sick more often, or cuts, scrapes, and injuries take noticeably longer to heal. Sign number 12, anxiety, irritability, or emotional numbness. Cortisol affects brain chemicals that regulate mood, leading to heightened anxiety, easy frustration, mood swings, or feeling emotionally flat even when life circumstances haven't changed. Now let's be very clear about what causes truly high cortisol. There are medical causes, like Cushing syndrome, a tumor in the pituitary or adrenal gland causing uncontrolled cortisol production. This is rare, but serious, and often requires imaging, hormone testing, and sometimes surgery. The most common medical cause today is long-term use of corticosteroid medications, prednisone, hydrocortisone, etc., prescribed for autoimmune diseases, inflammation, asthma, allergies, or chronic pain. These can produce all the same physical signs as natural Cushing syndrome. Then there's physiologic elevation, your body's normal response to chronic stress, pain, illness, overexercising, poor sleep, or major life stressors. In the short term, This is protective. But when stress never lets up, cortisol stays elevated and starts causing wear and tear. There's also pseudo-Cushings, conditions that mimic true Cushings, but cortisol normalizes once the underlying issue is treated. Important point: everyday stress alone almost never causes the dramatic physical signs like moon face, purple striae, buffalo hump, or severe bruising. Those point to pathologic elevation, Cushing's, or steroids. Facial puffiness from poor sleep, high salt, allergies, or aging is far more common and not the same thing. So if you're seeing several of these signs together, especially the physical changes, talk to your doctor. Testing, saliva, blood, urine cortisol, dexamethasone suppression test, etc., can clarify what's happening. If your cortisol is elevated due to lifestyle factors, chronic stress, poor sleep, overwork, blood sugar swings, here are evidence-based ways to bring it down naturally. Prioritize sleep. Aim for 7 to 9 hours nightly. Same bedtime every night. Avoid screens 1 to 2 hours before bed. They suppress melatonin and keep cortisol higher. Practice mental rest. Deep breathing, gentle stretching, yoga, meditation, or even 10 minutes of quiet time without devices can activate the parasympathetic, rest and digest system and lower cortisol. Stabilize blood sugar. Don't skip meals. Eat balanced meals with protein, fiber, and healthy fats. Avoid sugary snacks or refined carbs that cause spikes and crashes, which trigger more cortisol. Consider adaptogens. Ashwagandha has good evidence for gently lowering cortisol in stressed individuals. Talk to your doctor before starting supplements. Balance exercise. Movement is great, but excessive high-intensity training without recovery can raise cortisol further. Mix in walking, yoga, or light strength training, and prioritize rest days. High cortisol can be damaging, but it's also measurable, treatable, and often reversible. If you're concerned, don't guess. Get the right labs and professional guidance. Please leave a like if this helped, subscribe for more endocrine and hormone health insights, and drop a comment. Which sign surprised you most? See you in the next video. Take care of yourself.